It is interesting that both India and Brazil have taken seriously the problem of social welfare payments. So the Bolsa in Brazil and the scheme that you were talking about in India, delivering the 1,000 rupees on a mobile phone. What is it about health that makes people seem to demand it less than maybe social welfare payments?
I don't know. I suppose you have to look at why health becomes politicized. So, it's often said that in Europe or North America it would be political suicide to suggest rationing healthcare. It clearly isn't political suicide to suggest it in Brazil, for example. Why is that? Well, I suppose, one, we have an older population, and we have a population that's aging far more rapidly. And so you can argue, I'm sure it's right, that older people worry more about health than younger people. So that may be a part of the dynamic. I think a second part of the dynamic may be that healthcare has become more democratized in Western Europe and North America. We question doctors much more. Probably not enough, but we do demand much more of a say in healthcare. Whereas that's an evolving thing in poorer countries where there has historically been a shortage of medical professionals.
And you accept what the doctor says, really,
or you're more inclined to.
Yes,
that's right.
Yes.
And I mean that is shifting,
Yes.
and certainly we've seen some amazing pieces of investigative journalism in India recently about the shortcomings of delivery of medicine. But I think the key is we've got to make health more politicized. It has to become more part of the political arena. Politicians have to see costs associated with not delivering adequate healthcare to their people, and that hasn't happened in most of the emerging economies yet.